Well, welcome everyone to Innovation Park at Missouri University of Science and Technology. We're very pleased to welcome Governor Nixon to Rolla and to Missouri University of Science and Technology. I'm Kent Ray. I'm the provost here at Missouri S&T, and I'm pleased to welcome you all here today for a discussion of a very important medical, social, and economical topic. It's fitting that we meet here in Innovation Park just across the street from Phelps County Regional Medical Center. Missouri S&T and PCRMC are partners in a number of innovation endeavors, including clinical trials of a special borate glass fiber that has shown great success in treating open wounds. And I'm also pleased to introduce PCRMC's Chief Executive Officer, Mr. John Denbo. Mr. Denbo will tell you more about the reason we're here today. So please join me in welcoming John Denbo to the podium.
Well, thank you all for coming. It's a pleasure to be here. It's a privilege to get to introduce our governor. The issue that brings us here today, the expansion of Medicaid for the state of Missouri that you're going to hear all about, is an issue that is of absolutely vital importance to institutions like Phelps County Regional Medical Center. We have in the audience Dennis Pryor, who's the CEO of Salem District Hospital. It's an issue of absolutely vital importance to them. In fact, every hospital in the state, there could not be a more critical issue. At this current time, I think, particularly in rural communities, for the first time in a long time, the threat of the needing to curtail, cut back services, or in some instances, actually closure of facilities, is actually becoming a reality, or could become a reality. Now, we don't want that to happen. And certainly, that's what the governor's here to talk about. Phelps County Regional Medical Center supports this expansion, or supports the resulting increase in almost 300,000 people that could obtain access to Medicaid that currently don't have it, and also monies to go back to the healthcare providers who are currently providing this care and receiving very little to no reimbursement. So, without further ado, it's my pleasure to introduce Governor Jay Nixon.
Thank you, John, and thanks to the team here at Missouri S&T's Innovation Park for hosting us today. Provost Wren, we appreciate your work. I'm sorry I couldn't get here last week, but we were dealing with the second of back-to-back snowstorms, which will pay off for us in better crops than we hopefully this year, and better water than we had last year. I'm also pleased to be joined by this impressive group of leaders of your community, leaders in healthcare, education, business, and law enforcement. And it's fitting that we're here at a business development center because the most important decision facing our state today is fundamentally a business decision. The folks standing with me today understand that bringing billions of our Missouri tax dollars back to Missouri to strengthen Medicaid will have a profound and positive impact not only on our health, but also on the local economy here in Rolla and in communities in every corner of our state. Now, as your governor, I have both the opportunity and the obligation to keep Missouri's economy moving forward. And that's what we've done. Our economy continues to grow. Our unemployment rate has been below the national average for 41 straight months. Last year, Missouri added 40,000 jobs. Those of you who watch the unemployment numbers, it dipped to 6.5%, a 0.2 drop over the last month here in the Show Me State. That's solid economic progress. And making sure we continue to build on this progress has everything to do with how we decide to move forward on health care. And the question now before us is a narrow one. Will we bring the tax dollars we send to Washington back home to strengthen our Medicaid system here in Missouri? Or will we let the tax dollars Missourians send to Washington be spent in other states instead? Other states would get the benefits, we'd get the bill. The answer is clear. The people of Missouri deserve to see their tax dollars come back to their communities. That is why my budget for fiscal year 14 includes the federal funding to provide basic health coverage for an estimated 300,000 more Missourians who currently have no health insurance. It's the smart thing to do, and it's the right thing to do. Now, why is it the smart thing to do? Because for the first 3 years, 100% of the cost of providing health insurance for those additional folks will be covered by federal funds. 100%. That first full year, that's $1.8 billion coming back here to Missouri. That 100% funding is only available for the next 3 years. That's why we need to move forward now. Even after that, Missouri will only gradually pick up a small share of the costs, starting with 5% in 2017 and not exceeding 10% by 2020. If we take a pass on billions of healthcare dollars, that money will go to some other state. And I want Missouri dollars to work to improve, reform healthcare here in Missouri. If we look at this as a business decision, it's clear this proposal would be a big win for our economy. That's why it's been endorsed by a broad coalition of business groups across our state, including the Missouri Chamber of Commerce, the Associated Industries of Missouri, and chambers in Cape Girardeau, Bolivar, Branson, Hannibal, Independence, Kansas City, Kirksville, Lee Summit, Sedalia, Springfield, St. Louis, and the list continues to grow. For these business leaders, this is not a political decision. It's an economic one. And we shouldn't let last year's politics get in the way of next year's economic growth. Moving forward with this plan will bring a total of $5.7 billion to Missouri in the first 3 calendar years at no additional cost to the state. The University of Missouri estimates that this will generate an additional 24,000 jobs, and that's just in 2014. We're talking about good jobs for nurses, doctors, pharmacists, therapists, medical technicians. Strengthening Medicaid will strengthen our economy. Without question, it's the smart thing to do. And you know, there's a human element to this that also can't be ignored. A stronger Medicaid system will make health care available to 300,000 of our friends and neighbors, working Missourians who simply can't afford health care coverage. We're talking about a family of 4 with a household income of roughly $32,500 per year. Folks working every day that just don't have the access to availability of health care, that this would help bridge that gap. There are people who work hard but just can't afford to go to the doctor for preventative or even necessary treatment. And as a result, they often end up in our hospital emergency rooms. It's a terrible way to deliver health care. It puts a heavy burden on our doctors, nurses, and hospitals. It drives up premiums for individuals and businesses, and that must change. Here in Missouri, work is a value that should be rewarded, not discouraged. Seizing this opportunity to strengthen Medicaid the Missouri way makes good common sense, good fiscal sense, and good business sense for the Show Me State. Now, just as there are clear benefits to seizing this opportunity, there are also high costs to letting it pass us by. Sending these dollars to other states to strengthen other communities will have serious consequences for our state and our communities. So what are the costs of inaction, and who will bear them? For our economy, inaction means fewer jobs, 9,000 according to the Missouri Hospital Association. For families and businesses, inaction means crowded emergency rooms and higher insurance premiums, an estimated $1.1 billion in increased costs over the next several years. For our communities, it means fewer mental health services for those that need it the most. The Department of Mental Health estimates that hundreds of inpatient psychiatric beds will be cut from a system already struggling to meet current needs. And for the law enforcement officers standing with me today, inaction means more mentally unstable individuals not getting the proper treatment, cycling between the local emergency room and the local jail. And let's not kid ourselves. On the side of developmental disabilities, this is a key area for us, but on the side of folks with serious mental challenges who are acting out far too often, those folks present themselves to the emergency room. The sheriff or the police is called to take them. They take them to the city jail, the county jail, where they stay for a few days and then are released and then are back out again. Over the last 15 or 20 years in this country, we've done the right thing in mental health in one area, and that is we have attempted to deinstitutionalize and put folks in community placement. Okay? But if we back up on the needs for psychiatric treatment, the way that will happen if we don't move forward here, make no mistake, there will be more dangerous people out there challenged and needing our help. And that's why these friends in law understand that oh so well. And it's also important to understand that standing still will not leave us in the same place we started. If we do not move forward, we'll slip far behind. with fewer jobs, higher costs, less safety, and that is not the right direction for the Show Me State. This is an issue that transcends politics. Across the country, we're seeing governors and legislators put politics aside to do what's undeniably best for their state. For example, just last week, Republican Governor Chris Christie of New Jersey announced his plans to use these federal funds to strengthen Medicaid in his state. The week before, it was Republican Governor Rick Scott of Florida announcing his support. And they're not alone. The Republican governors of Arizona, Michigan, North Dakota, New Mexico, Nevada, and Ohio have all announced that their support and intention to bring these federal dollars to their states to strengthen Medicaid for their citizens. They're doing this not because it's the easy thing for them to do politically, but because it's the smart thing to do economically. Here in Missouri, we must make the smart business decision, the right human decision, and bring these tax dollars we send to Washington back here to work in Missouri. Before I take questions from the press here, I want to just make one more point, and then I'll be glad to take questions. I'll make 2 points, sorry. Only 2, don't worry. First is, this room is like rooms I've been in all across the state. The only problem that we have had as we have traveled to West Plains and Bolivar and St. Louis and Kansas City and Trenton and other places is that we don't have rooms big enough for all the people that are interested in moving forward on this issue. Once again, I mean, we're crowded to the gills, the doors are filled, it's a warm room. That's good, human heat. The second piece is, this really is the right thing to do. I would bet that just about everybody in this room, if not everybody in this room, has some form of health care coverage. And when you go to a hospital or a doctor's office or nurses or urgent care or whatever, and you go to the front desk, you slide across a card, you take out of your purse or out of your pocket, and they smile and they write the numbers down and they give you treatment. There's a whole lot of working Missourians that don't have that. People who work every bit as hard as us. People making 10, 11, 12 bucks an hour, working in factories, working in daycare centers all over the state. That this is simply the right thing to do, to help them as they move up the economic ladder, to have the basic dignity of health care as they do, so that they get preventative care and they're healthier and better workers, so that they don't have to go to sleep at night worrying about what's going to happen if an injury happens and they're one injury or one illness or one sickness away from medical bankruptcy. This is quite simply, folks, not only the smart thing to do economically, but the right thing to do, and consequently we are working extremely hard to get it accomplished. With that, I'll be glad to take questions from the press or anybody else. Yes, ma'am.
I'd like to know, do you know the number, the percentage of people in this community that are not insured?
I don't have the exact number here. I can get that. If you get just get the information to one of my.
What impact does the hospital have?
The impacts of the hospital will be twofold. First of all, you'll pick up folks that don't have insurance that are working and making less than $32,500 a year for a family, for less than about $15,500 for an individual will be covered under Medicaid, so they will get health care. But the second part of this, when I talked about us, if we don't do it, we won't just stand still. We have a system in Missouri that allows hospitals, for example, to get what are called disproportionate share dollars for the coverage they give to folks that don't have insurance. That's the system we've developed here in Missouri, and that money is going away. I mean, under this, so consequently, the actions here are not just on the positive side. I mean, if we move forward with the expansion, there'll be additional coverage, but if we don't, those disproportionate share dollars will back up, will move out, and the system will be much more difficult to operate with. Missouri gets about $571 million a year in that. This is a process of beginning to move those dollars away. Another quick question. Yes.
My sister is a nurse in Truman Medical Center in Lee Summit. She says the reason, for the most part, that the emergency rooms are filled is because of so many people on Medicaid. So how would you actually strengthen Medicaid besides just throwing money at it?
Yeah, I mean, I think we are having a lot of folks that present themselves to emergency rooms as their first call for health care. And the reason they do it is that the law requires hospitals to deal with folks that show up there. The only way we're going to get a reform that allows those emergency rooms to triage those folks to places that are the right place, preventative care, places where they can get some other coverage, is to take these dollars and get the improvements put in our system. Right now, there's a whole lot of folks with insurance and without insurance showing up to emergency rooms, but it's causing an overcrowded, it's causing significant challenge in those emergency rooms. I think a significant portion of the folks that are showing up in emergency rooms are folks that don't have insurance at all, which means a couple things. It means it makes it difficult for folks that do have insurance to get the needed treatment they need, but it also, since it's so expensive, it drives premiums up for everybody else. When you present yourself to the most expensive place for healthcare, so it's like if you needed to drive somewhere, it's like saying, all right, I'm going to go to the Maserati dealership to get a vehicle. Going to the emergency rooms in healthcare is literally the most expensive place you can show up. It's expensive in time, it's expensive in money, and consequently that's a problem. So what we want to do is we want to get more people coverage so they get the preventative care they need, and we can get the changes we need inside the system. The way to do that is to move this forward. I'll take one more quick question, anybody?